Since antibody for COVID-19 came out in April, there's been so many questions as to like, why would we do this or should we do this? So I wanted to just take a minute to give you my opinion on antibody testing. Couple components of that. One is the antibody testing is not to look at COVID-19, but it's to look at the virus that causes COVID-19. So it's known as SARS-CoV-2. So we can test the antibody production to see if that's elevated. Now, if you think you've had COVID, one way to confirm that, especially if you weren't able to do the nasal swab to get a positive test, is to do the antibody test, because if those antibodies are elevated, we can make a good clinical assumption that you probably did have COVID. The other nice thing about that is to give you a little bit more peace of mind as well, to say, hey, I've been through this. Maybe I didn't go through it so badly, or at least knowing you got on the other side of it, the theory behind having some immunity is there. Now, what we don't know is how long that immunity is good for. Here in the office, we've tested starting in April, and we have had now some repeat tests 6 and 7 months later. I'm excited to tell you that all of those have maintained their antibody activity at this point. So we do believe that there is theoretical immunity at least 6 months past, and we're going to continue to test that. If you're not sure if you've had it, and you just want to confirm, let us know. We're doing the antibody testing here. It's a blood draw. We can either do it through the arm or we can do it through a finger stick. It takes us about 5 to 7 days to get back, and then we discuss it. Can give you some peace of mind, and it can also confirm whether or not you've had it or not. Let us know how we can help.